What is type 1 diabetes? Diabetes occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes mainly from the food you eat. Insulin, a hormone made by the pancreas, helps the glucose in your blood get into your cells to be used for energy. Another hormone, glucagon, works with insulin to control blood glucose levels. In most people with type 1 diabetes, the body's immune system, which normally fights infection, attacks and destroys the cells in the pancreas that make insulin. As a result, your pancreas stops making insulin. Without insulin, glucose can't get into your cells and your blood glucose rises above normal. People with type 1 diabetes need to take insulin every day to stay alive. Who is more likely to develop type 1 diabetes? Type 1 diabetes typically occurs in children and young adults, although it can appear at any age. Having a parent or sibling with the disease may increase your chance of developing type 1 diabetes. In the United States, about 5% of people with diabetes have type 1. What are the symptoms of type 1 diabetes? 1. Symptoms of type 1 diabetes are serious and usually happen quickly, over a few days to weeks. Increased thirst and urination, increased hunger, blurred vision, fatigue, unexplained weight loss. 2. Sometimes the first symptoms of type 1 diabetes are signs of a life-threatening condition called diabetic ketoacidosis, DKA, NIH external link. Some symptoms of DKA include, breath that smells fruity, dry or flushed skin, nausea or vomiting, stomach pain, trouble breathing, trouble paying attention or feeling confused. What causes type 1 diabetes? Experts think type 1 diabetes is caused by 1. Genes. 2. Factors in the environment, such as viruses, that might trigger the disease. How do healthcare professionals diagnose type 1 diabetes? 1. Random plasma glucose, RPG, test to diagnose type 1 diabetes. This blood test measures your blood glucose level at a single point in time. 2. The A1C blood test to find out how long someone has had high blood glucose. Even though these tests can confirm that you have diabetes. 3. To find out if your diabetes is type 1, test your blood for certain autoantibodies. 4. Autoantibodies are antibodies that attack your healthy tissues and cells by mistake. 5. The presence of certain types of autoantibodies is common in type 1 but not in type 2 diabetes. 6. Because type 1 diabetes can run in families, your healthcare professional can test your family members for autoantibodies. 7. The presence of autoantibodies, even without diabetes symptoms, means the family member is more likely to develop type 1 diabetes. 8. If you have a brother or sister, child, or parent with type 1 diabetes, you may want to get an autoantibody test. 9. People age 20 or younger who have a cousin, aunt, uncle, niece, nephew, grandparent, or half-sibling with type 1 diabetes also may want to get tested. What medicines do I need to treat my type 1 diabetes? If you have type 1 diabetes, you must take insulin because your body no longer makes this hormone. Different types of insulin start to work at different speeds, and the effects of each last a different length of time. You may need to use more than one type. You can take insulin a number of ways. Common options include, 1. A needle, 2. Syringe, 3. Insulin pen, 4. Insulin pump. Some people who have trouble reaching their blood glucose targets with insulin alone also might need to take another type of diabetes medicine that works with insulin. Premlintide, given by injection, helps keep blood glucose levels from going too high after eating. Few people with type 1 diabetes take Premlintide. The NIH has recently funded a large research study to test use of Premlintide along with insulin and glucagon in people with type 1 diabetes. Another diabetes medicine, metformin, may help decrease the amount of insulin you need to take, but more studies are needed to confirm this. How else can I manage type 1 diabetes? Along with insulin and any other medicines you use, you can manage your diabetes by taking care of yourself each day. Following your diabetes meal plan, being physically active, and checking your blood glucose often are some of the ways you can take care of yourself. Work with your healthcare team to come up with a diabetes care plan that works for you. If you are planning a pregnancy with diabetes, try to get your blood glucose levels in your target range before you get pregnant. Do I have other treatment options for my type 1 diabetes? 1. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDK, has played an important role in developing artificial pancreas technology. An artificial pancreas replaces manual blood glucose testing and the use of insulin shots. A single system monitors blood glucose levels around the clock and provides insulin or a combination of insulin and glucagon automatically. The system can also be monitored remotely, for example by parents or medical staff. 2. In 2016, the U.S. Food and Drug Administration approved a type of artificial pancreas system called a hybrid closed-loop system. This system tests your glucose level every 5 minutes throughout the day and night through a continuous glucose monitor. B. And automatically gives you the right amount of basal insulin. C. A long-acting insulin. D. Through a separate insulin pump. You still need to manually adjust the amount of insulin the pump delivers at meal times and when you need a correction dose. You also will need to test your blood with a glucose meter several times a day. The continuous glucose monitor sends information through a software program called a control algorithm. Based on your glucose level, the algorithm tells the insulin pump how much insulin to deliver. The software program could be installed on the pump or another device such as a cell phone or computer. 3 different types of artificial pancreas devices to better help people with type 1 diabetes manage their disease. The devices may also help people with type 2 diabetes and gestational diabetes. 4. Research into pancreatic islet transplantation and experimental treatment for hard-to-control type 1 diabetes. A pancreatic islet transplant replaces destroyed islets with new ones that make and release insulin. This procedure takes islets from the pancreas of an organ donor and transfers them to a person with type 1 diabetes. Because researchers are still studying pancreatic islet transplantation, the procedure is only available to people enrolled in a study. Complications of type 1 diabetes. Over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, foot problems, depression, sleep apnea. Can I lower my chance of developing type 1 diabetes? At this time, type 1 diabetes can't be prevented. However, through studies such as TRIA-LNET, researchers are working to identify possible ways to prevent or slow down the disease. Types of insulin. 1. Rapid-acting. Because they work quickly, they are used most often at the start of a meal. Rapid-acting insulin acts most like insulin that is produced by the human pancreas. It quickly drops the blood sugar level and works for a short time. If a rapid-acting insulin is used instead of a short-acting insulin at the start of dinner, it may prevent severe drops in blood sugar level in the middle of the night. E.g. Apidra, insulin glycine, onset, 10 to 15 minutes, peak 1.5 hours duration, 3 to 5 hours. B. Novorapid, insulin aspart, onset, 10 to 15 minutes. Peak, 1 to 1.5 hours duration, 3 to 5 hours. C. Humalog, insulin lispro, onset, 10 to 15 minutes. Peak 1-2 hours. Duration, 3.5 to 4.75 hours. 2. Short-acting, insulins take effect and wear off more quickly than long-acting insulins. A short-acting insulin is often used 30 to 60 minutes before a meal so that it has time to work. These liquid insulins are clear and do not settle out when the bottle, vial, sits for a while. E.g., Humulin R, Novolin GE Toronto, insulin regular, onset 30 minutes. Peak 2 to 3 hours. Duration 5-6 hours. 3. Intermediate and long-acting, insulins contain added substances, buffers, that make them work over a long time and that may make them look cloudy. When these types of insulin sit for even a few minutes, the buffered insulin settles to the bottom of the vial. But insulin glargine, Lantus, and insulin detemir, levemir, are clear liquids, not cloudy. Humulin N, Novolin GENPH, insulin NPH onset 1 to 3 hours. Peak 3-5 hours. Duration 5 to 8 hours. For mixtures, mixtures of insulin can sometimes be combined in the same syringe, for example, intermediate acting and rapid or short acting insulin. Not all insulins can be mixed together. For convenience, there are premixed rapid and intermediate acting insulin. The insulin will start to work as quickly as the fastest acting insulin in the combination. It will peak when each type of insulin typically peaks, and it will last as long as the longest acting insulin. Examples include A 30% regular and 70% NPH Humulin 30/70ths, Novolin GE 30/70ths. B 50% Lispro and 50% Lispro-Protamine, Humalog Mix 50. C 25% Lispro and 75% Lispro-Protamine Humalog Mix 25. D 30% Aspart and 70% Aspart-Protamine Novo Mix 30. Long-acting insulin, A Lantus, insulin glargine, onset, 1.5 hours. Peak, does not apply. Duration, up to 24 hours. B levemir, insulin detemir, onset, 1.5 hours. Peak, does not apply. Duration, 16-24 hours. C Toujeo, insulin glargine U300. Onset, up to hours. Peak, does not apply. Duration, up to 30 hours. How do I take insulin for diabetes? You can give yourself an insulin injection using 1. A needle, 2. Syringe, 3. A cartridge system, 4. Or prefilled pen systems, 5. Inhaled insulin, 6. Insulin pumps, 7. A quick-acting insulin device are also available. If you're using an injectable insulin, the place on the body where you give yourself the shot may affect the timing of its benefit to you. You'll absorb insulin the most consistently when you inject it into your belly. The next best places to inject your insulin are the arms, thighs, and buttocks. You should try to consistently inject insulin at the same general area of your body. Within that general area, you should alternate the location of the exact injection spot. This helps minimize scarring under the skin.